In this video, you will learn when ginger, a spice often praised for its health benefits, can actually become a threat to your well-being. Although it is considered a natural remedy, in certain cases, ginger may cause serious complications and, in extreme situations, even result in the loss of life. We will go over 10 specific scenarios in which ginger can be dangerous, particularly for individuals with certain health conditions. This information can help you protect your health and avoid making a critical mistake. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Stop using ginger immediately if you have circulatory issues. The much praised blood thinning effects of ginger, due to its active compounds like gingerol, can be a double-edged sword for people with blood circulation disorders. Although ginger is commonly used as a spice and natural remedy, its potential to interfere with the body's natural blood clotting process raises serious concerns for individuals who are prone to heavy bleeding. In such cases, ginger can make the condition worse. In the United States today, more than 3 million people live with various blood clotting disorders. Around 20,000 people have hemophilia, and approximately 1 to 2% of the population takes anticoagulants on a regular basis. For these individuals, consuming ginger can be especially risky since it contains substances that inhibit platelet aggregation by 40 to 60%, an effect similar to low-dose aspirin. Among patients with clotting disorders who regularly consume ginger, about 7 out of 10 experience an increase in bleeding time by an average of 3 to 5 minutes, which can be critical in the event of injury or during surgery. Consulting medical professionals is essential to receive personalized guidance tailored to each individual's health condition. Stop using ginger immediately if you have diabetes. Although ginger is known for its potential to help lower blood sugar levels, it can also pose significant risks for people living with diabetes. A sudden drop in blood sugar can cause various issues, ranging from dizziness to fainting. Additionally, the combination of ginger's blood-thinning properties with diabetic conditions may create further complications. In the United States, more than 37 million people, about 11.3% of the population, have diabetes, and roughly 90 to 95% of them have type 2 diabetes. Around 85% of individuals with diabetes take medication to control their blood sugar levels. Ginger can reduce glucose levels in the blood by 15 to 20% within 2 to 3 hours after consumption. This is particularly dangerous for patients already taking hypoglycemic drugs. Statistics show that 1 in 5 people with diabetes who regularly consume ginger experience episodes of hypoglycemia that require urgent correction. Furthermore, for 30% of patients with diabetic nephropathy, ginger may worsen kidney damage by increasing renal blood flow. People with diabetes need to monitor their ginger intake carefully, considering the potential complications, including digestive discomfort. Consulting a healthcare provider is essential to ensure a balanced approach that fits into each person's individualized diabetes treatment plan. Stop using ginger immediately if you have gallbladder issues. For individuals dealing with gallbladder problems, the way ginger stimulates bile production and its blood-thinning effects must be taken seriously. Even though ginger is known for its anti-inflammatory and antioxidant properties, consulting a healthcare provider is absolutely necessary in such cases. Gallstone disease is one of the most common digestive disorders in the United States, affecting about 25 million people, which is roughly 10 to 15% of the adult population. However, only 20 to 30% of these cases are diagnosed, while the rest remain unnoticed until complications arise. Ginger can increase bile production by 60 to 70% and can also enhance gallbladder contractions by nearly 1.5 times. For people who have gallstones, this significantly raises the risk of bile duct obstruction by approximately 38%, which can lead to severe pain that may require emergency medical attention. About 65% of patients with stones larger than 8 millimeters experience worsened symptoms within an hour of consuming ginger. In addition, 1 in 3 individuals with cholecystitis may have an inflammatory response triggered by ginger. Taking a cautious approach to ginger consumption allows people with gallbladder conditions to seek safer alternatives and prevent the possible aggravation of their symptoms. Stop using ginger immediately if you have heart disease. While ginger's ability to stimulate blood flow and improve circulation can be beneficial, it may pose serious risks for individuals with pre-existing heart conditions. Beyond concerns about irregular heartbeat, it is important to consider how ginger's natural blood-thinning properties can interact with medications. Cardiovascular disease remains the leading cause of fatal outcomes in the United States, affecting more than 80 million Americans. Around 8 million people have coronary artery disease, and approximately 6 million live with heart failure. About 8 to 12% of individuals over the age of 65 take anticoagulants to prevent blood clots. Ginger can enhance the effects of these medications by 25 to 30%, significantly increasing the risk of bleeding. For those with arrhythmias, about 5 million Americans, ginger can raise heart rate by 5 to 10 beats per minute, which can be dangerous in cases of tachyarrhythmia. Among individuals taking warfarin, the risk of minor bleeding, such as nosebleeds or bleeding gums, triples with ginger use. Approximately 4% of patients combining ginger with anticoagulant therapy require hospitalization due to serious hemorrhagic complications. Understanding these risks is especially important for people already on blood-thinning medications, and it is essential to consult medical professionals to help minimize potential complications. Stop using ginger immediately if you're taking any medications. Whether you are on medication for blood pressure, diabetes, or blood thinning, it is crucial to understand that ginger can significantly alter how these drugs work. While it may seem like nothing more than a root, the active compounds in ginger can unexpectedly enhance or weaken the effects of many medications. This is particularly concerning when it comes to anticoagulants, antihypertensive drugs, insulin, and even immunosuppressants used after organ transplants. According to the American Pharmacological Society's 2023 data, ginger can intensify the effects of more than 85 commonly used medications. In a study involving 1,800 patients, 114 cases of significant drug interactions with ginger were documented. Alarmingly, some of these interactions led to serious outcomes. Among those taking anticoagulants such as warfarin or aspirin, the risk of bleeding increased by 27 to 34%. Patients on blood pressure medications experienced an additional drop in systolic pressure by 7 to 12 millimeters of mercury, with about half of the participants affected. For individuals with diabetes, the concerns are even more serious. Nearly 29% experienced intensified insulin effects, which triggered sharp episodes of hypoglycemia. Even over-the-counter pain relievers, like non-steroidal anti-inflammatory drugs, when combined with ginger, raise the risk of gastrointestinal bleeding by nearly 20%. For transplant patients, ginger reduced blood concentrations of cyclosporin by 25 to 30%, potentially endangering the success of the transplant itself. That is why, if you are taking any medications, especially those prescribed by your doctor, you must consult a medical professional before using ginger. Only a qualified specialist can accurately determine whether this seemingly harmless spice might interfere with your treatment plan. Stop using ginger immediately if you are dealing with excess weight loss or struggling to maintain your current weight. Ginger is widely known for its ability to speed up digestion and keep metabolism active. However, for people who are trying to gain weight or at least maintain it at a stable level, this plant can unexpectedly become an obstacle. This is especially true for individuals with low body weight or increased energy demands, where any metabolic shifts can lead to even greater weight deficiency. A study conducted by the United States National Institutes of Health in 2023 found that consuming just 2 grams of ginger daily can significantly increase energy expenditure by an average of 109 kilocalories per day. This means someone with an already high metabolism could continue to lose weight even when eating a calorie-rich diet. In the same study, which involved 436 participants with a body mass index below 18.5, nearly 3/4 of them experienced slower weight gain despite increased food intake. What else did the researchers observe? Participants reported a decrease in appetite by nearly 17%. Gastric emptying occurred 25% faster, and the absorption of fats and carbohydrates in the intestines dropped by 11.6% and 8.2%, respectively. As a result, people felt full more quickly, and essential nutrients were not fully absorbed. So, if you are trying to gain weight, recover after an illness, or simply maintain your energy balance, you may want to consider whether ginger is holding you back. Talking to a doctor or dietitian can help you adjust your diet in a way that allows you to benefit from ginger without sacrificing your health or body weight. Stop using ginger immediately if you are pregnant. During pregnancy, many women try to choose only the safest and most beneficial options for their bodies and their future child. Ginger is often seen as a natural remedy for nausea, especially in early pregnancy. But behind this seemingly harmless root are risks that should not be overlooked. According to 2024 data from the American College of Obstetricians and Gynecologists, pregnant women should limit their ginger intake, particularly during the first trimester. A large-scale study involving 3,450 pregnant women found that consuming more than 1.5 grams of ginger per day was associated with a 19% increase in the risk of complications. What kinds of complications are we talking about? The most common was increased vaginal bleeding, which occurred in 23.7% of women who regularly consumed ginger during the first trimester. For those who continued taking ginger after 28 weeks, the risk of preterm labor increased by 16.4%. Moreover, 35.8% of participants who drank ginger tea daily experienced a reduction in progesterone levels, a hormone that is essential for maintaining pregnancy. In the group that consumed more than 2 grams of ginger per day, the rate of spontaneous miscarriage was 8.7% higher than in the control group. Postpartum bleeding also increased, on average by 150 milliliters among women who consumed ginger during the third trimester. So even if you have always considered ginger to be a healthy supplement, it is best to be cautious during pregnancy. This is especially important if you have a tendency toward gastrointestinal issues or hormonal imbalances. Speaking with a doctor can help determine a safe dose or recommend alternatives that will support the health of both mother and baby, rather than put it at risk. Stop using ginger immediately if you have low blood pressure. Ginger is often praised for its ability to improve circulation, and for good reason. Active compounds like gingerol and zingiberine do indeed help dilate blood vessels and can lower blood pressure. But what benefits some people can cause serious issues for others, especially those who already have low blood pressure. A 2024 study by the American Institute of Hypertension found that regular ginger consumption can reduce systolic blood pressure by an average of 5 to 8 millimeters of mercury and diastolic pressure by 3 to 6 millimeters of mercury. For people with normal or high blood pressure, this can be helpful. But for those whose blood pressure is already low, even a slight drop can lead to dizziness, weakness, and fainting. Participants who started with blood pressure readings below 100 millimeters of mercury were particularly sensitive to ginger. Just 500 milligrams caused an additional drop of 7.4 millimeters of mercury within the first 3 hours. Among these individuals, 23.7% experienced episodes of orthostatic hypotension, a sudden drop in blood pressure when standing up, for example, after getting out of bed. In fact, 42 people in the group, almost 6%, fainted after drinking a cup of ginger tea, especially following physical exertion. Researchers also documented a strong correlation. The higher the concentration of gingerol and shogaol in the bloodstream, the more the blood vessels dilated and the more dramatically blood pressure fell. The correlation coefficient was 0.78, which is considered very high. So if you know that your blood pressure tends to be low or you are prone to sudden drops, be very careful. In your case, ginger is not just a harmless spice, it is a bioactive substance that affects vascular tone. Before including it in your diet, especially in concentrated drinks or supplements, it is essential to consult with a healthcare provider. Stop using ginger immediately when preparing for surgery and during recovery afterward. Getting ready for surgery involves more than just doctor visits and lab tests. It also requires paying attention to even the smallest details, including what you eat or drink. One seemingly harmless but potentially risky ingredient is ginger. It significantly affects blood clotting and blood sugar levels, which can seriously complicate both the procedure itself and the recovery period. The American Society of Anesthesiologists strongly advises completely avoiding ginger for at least 7 days before any scheduled surgery. This recommendation is based on an analysis of more than 5,300 surgical procedures conducted in 2024. The findings were concerning. Among patients who continued to consume ginger in the days leading up to surgery, the risk of postoperative bleeding increased by 31%. Blood clotting time, which is critical for stopping blood loss, was extended by an average of 15 to 20%. What does this mean in practical terms? During surgery, these patients experienced blood loss that exceeded the average by 125 milliliters. They were also nearly 27% more likely to develop hematomas at the surgical site compared to those who had stopped consuming ginger. In 18.5% of cases, surgeons had to perform a blood transfusion during the operation. Another troubling pattern was observed. 67% of these patients showed an increased activated partial thromboplastin time, APTT, a marker of delayed clotting. Platelet activity, the cells responsible for stopping bleeding, was reduced by 22%. These statistics speak for themselves. Even if you consume ginger only as a spice, in tea, or as a supplement, it is essential to take this into account when preparing for surgery. During this period, it is better not to take any chances. Make sure to inform your doctor about everything in your diet and all supplements you are using, and most importantly, stop consuming ginger well in advance. This simple step could play a crucial role in ensuring the safety of your surgery and a smooth recovery. Stop using ginger immediately if you have a spice allergy. Ginger may seem like a harmless spice that adds flavor and potential health benefits to tea or food, but for some people, even a small amount can pose a serious health risk, especially for those who are already allergic to other spices such as turmeric or cardamom. Ginger, turmeric, and cardamom all belong to the same botanical family, Zingiberaceae, commonly known as the ginger family. This means that people who are allergic to one of these spices are at high risk of having a cross-reaction to the others. This is not just speculation. It is backed by a large-scale study conducted by the American Academy of Allergy, Asthma, and Immunology in 2023. The study involved nearly 25,000 participants and revealed that about 2.8% of Americans, roughly 9 million people, have some form of allergy to plants from the ginger family. The numbers are striking. 78.6% of those allergic to ginger also reacted to turmeric. More than half, 51.3%, could not tolerate cardamom either. Nearly 1 in 4, 22.7%, were allergic to all three. What is especially concerning is that for 12.4% of individuals, their first reaction to ginger was anaphylactic, requiring an emergency injection of epinephrine. This is not just a rash or itching, it is a life-threatening condition. Even topical use of ginger, such as in creams, ointments, or essential oils, can cause contact dermatitis in people with ginger sensitivity. This reaction was observed in 37% of participants with ginger allergies. Furthermore, the presence of specific IgE antibodies to ginger proteins at concentrations above 3.5 kilunits per liter indicated a strong likelihood, nearly 9 times out of 10, that the person would experience a serious allergic reaction upon contact. If you have ever noticed symptoms like a rash, swelling, itching, or breathing discomfort after consuming ginger, turmeric, or cardamom, do not ignore it. It is safer to completely eliminate ginger-containing products and consult an allergist. Even if a previous reaction was mild, the next one could be much more severe. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.